Good afternoon, good morning, and good evening, everyone, and welcome to our first dialogue on tobacco control and cancer series. Today, we will discuss actually how the tobacco control and the cancer control communities could synergize their efforts, align their efforts, and maximize the impact to tackle the tobacco epidemic. So today, we will, just before starting, there are some ground rules for this dialogue. Unmute yourself only when you're talking, please. Camera on if the connection allows you to open the chat box and make full use of it and ask any question that you might have. And get your phone for an interactive event for the next couple of minutes. So I will pass the floor to our moderator today, Leslie Ray Ferrat, who will introduce the virtual dialogue, the first virtual dialogue on tobacco control and cancer. Thanks. Thank you a lot.
Thank you so much, Yannick, and thanks to Yannick and UICC for the invitation. Really excited to be a part of this kind of first virtual series, this virtual dialogue series on tobacco control and cancer. Just to quickly introduce myself, I am Leslie Ray Ferrat. As Yannick said, I am FCA's Executive Director. And just quickly to say that FCA is the Framework Convention Alliance for Tobacco Control, those who do not know. A global network of civil society organizations working towards a world free from tobacco and tobacco use. So we work very closely with the WHO and the colleagues at the Framework Convention on Tobacco Control, and also with multiple civil society organizations across over 100 different countries towards tobacco control. So I just wanted to quickly start as well with an introduction of our three speakers that we have today and give you quickly just a run through of how today is going to work. So we have Anil de Cruz, who is the president of UICC. We also have Adriano Blanco, who is the head of the WHO Framework Convention on Tobacco Control. And we also have Noor Obidat, who is the director of Cancer Control Office at the King Hussein Cancer Center. We've got about, looking at the time now, about 40 minutes to first hear from our three speakers with a few questions that we have for them. And then we're hoping to save about 15 or 20 minutes at the end to have a kind of live Q&A with all of you. So you'll be able to use the chat box when that time comes. We also have, as Yannick mentioned, a couple questions to the audience, and the colleagues at UICC will let you know how that's going to work when the time comes. So let's just get started. I'm just conscious of time here. So I wanted to just start first by asking, we kind of have a question of why, and then how, and what. So to get three different perceptions from the three different speakers here. The first question I wanted to ask, I'm going to start with Anil. Why do you think that cancer and tobacco control communities actually should synergize their efforts to address the tobacco epidemic? Oh, Anil, I think you're on mute, sorry. Anil, I think your microphone is muted.
I took Yannick very seriously when he said unmute when you speak, and I forgot. But congratulations to the organizers, Yannick and the whole group, for putting this virtual dialogue together. I think it's a very, very important topic. I say it both as president of the UICC. I say it as a clinician who spent 33 years of my life treating cancers, and more importantly, head and neck cancers, which are very important in our part of the world. 1/3 of all cancers are head and neck cancers, and they're primarily caused because of tobacco. So you ask me, why should the cancer and tobacco control communities synergize their efforts? To me, it's a no-brainer. It's just, we have all recognized for years and years that tobacco is the single most important preventable cause of cancer. It is responsible for close to 1/3 to 1/2 of cancers, depending on which part of the world you look at these figures. It's not only cancer, but it's also a lot of other non-communicable diseases that tobacco is responsible for. You see figures again and again, and I don't want to quote figures about 8 million deaths and 3 million because of cancer and how many because of second-hand smoke and how many occur in children. We know year by year these figures increase and they are staggering. And we need to do something to stop this epidemic, stop the scourge of tobacco usage. We must also remember that there are efforts being done predominantly in the developed part of the world, but we must remember that 2/3 to 80% of all tobacco users are from low and middle income countries. So we need to take our voice now to new areas, consolidate efforts in areas where we are seeing some effects, but take our voice to new efforts just to prevent the sheer morbidity and mortality or the ill health caused by tobacco. So there's absolutely no debate as to why cancer and tobacco control communities should not synergize. This is a war that we've been battling for years and years. I think the first reports came from the US Secretary General in the early 60s that tobacco is directly linked to lung cancer. The FCTC was framed sometime in the early 2000, 2003, and yet we have to all come together to make a strong impact against tobacco. So Leslie, these are my opening thoughts, and I can add as the other speakers contribute rather than making it into a kind of a small speech, but the figures tell you why we need to synergize our efforts.
Yeah, thanks so much, Anil. So I kind of wrote down no debate, no brainer as the two kind of main points coming from your quick intervention there. Adrian, I'd like to turn to you as the head of the Secretariat of the FCTC, and I'm sure you'll probably have very similar views that it's a no-brainer, and you know the answer is obvious. But I'd also just like to hear from you about why you think it's important, and maybe why we need to even strengthen more those collaborations more than ever, because I think what we've seen a lot is, yes, we do work with the cancer community, but maybe we don't work enough with the cancer communities from a tobacco control community perspective. So I'd like to also just ask you why you think it's so important.
Well, thank you very much, Leslie, and I totally agree with the words of Anil. So put the same two words for me. It's a no-brainer. There is no way that we cannot work together. And as you said, it's not that we are not working together, it's that we need to work more together, because you know that they say powers is in the numbers. And while we are pursuing at some point interests that overlap, because we have a common area that we need to address, I think that we need to be together addressing. First of all, because we have different constituencies, because we have different tools, let's say, on each one of the communities. For example, and I think that one of the important things when you want people to make a partnership is the question, what is in that for me? Okay, because usually we need to know, okay, what is that is there for me? Why I'm going to do an extra effort to help you, what I'm going to win. And I think that is clear that we offer different opportunities. While the tobacco control community is, and especially in my case, the Convention Secretariat, we offer the opportunity that we have a legal tool, okay? So there are some of the issues that the cancer community would like to achieve, that we have tools to help the countries to move in the right direction. While the cancer community usually is more close to the medical, to the clinical communities, and we need a lot of the people who work in the medical, because we can think that all the physicians are aware of this issue. But unfortunately, I remember in my own country making some research and seeing that the analyzing tobacco-related diseases, but so related, like pulmonary cancer or COPD, or cardiovascular diseases, and just a small percentage of these histories, records of the people has recorded the smoking status of the people. So how can you as a physician can see a COPD person and not having that record? So that's why we can help each other. The cancer community helping us to make more awareness in the health, let's say, part of the work, and we can help with the other sectors and with sometimes more structured ways of addressing this problem through legislation, through regulation. So I think that is part of what is there, even though we can talk about during hours for this.
That's really really good points there too about different groups for different tools and what each community can bring to each other. And I think I want to touch on that a little bit more when we get to number 3 about the what we can actually do and the different kind of types of tools and opportunities that we have to engage together. So I'm just going to park that because I want to get on. I want to hear from Noor, but I also want to come back to that because I think that's really important, like you said, of the win-win for each side of the equation here, and we can kind of just start to distill some of that later on in the discussion. So Noor, I'd love to just hear from you really quickly as well before we move on to actually the kind of what and how questions. So just a few little thoughts from you maybe on some of these synergies on the why.
Sure. Well, first of all, thank you for having me. I think our position is a little bit unique because I work in a cancer center and it's a cancer related NGO, but there's a small office or a small hub within that is tobacco control related. So if you'll allow me, what I can do is add my perspective with regards to synergies within the cancer control community in our organization, and also synergies with regards to other NGOs that we've dealt with. And really, I don't want to take up too much time, but over the past 10 years approximately, we've been doing a lot of work as a tobacco control NGO. We've worked on generating evidence for the government because the government in Jordan, and I believe in many developing countries, is very, it's a low resource government. They don't have enough to generate what they need in order to advocate for tobacco control. And so this is where our role as an NGO used to come in. We used to generate evidence to assist them. We used to advocate for them. We used to mobilize a lot of different community members to promote tobacco control. But over the years, I can tell you that regardless of how much we did, it's never enough and we need to do more. And we cannot do this without synergies. So that's one aspect of it. The other aspect of it is if we're in tobacco control and we're promoting tobacco control, we cannot promote tobacco control in a cancer center without having the cancer control community on our side. It just doesn't make sense. Those two would clash if the cancer control community was not supporting tobacco control efforts, because like Dr. Anil said, and like Dr. Adriana said, tobacco control is very much a part of cancer control. We talk about tobacco leading to cancer, but here at KHCC, we're also very adamant about the impact of continued tobacco use in cancer treatment. And so we're very much, we very much need for the cancer control community, the medical community, the oncologists to be on board with recognizing how dire the situation is with regards to tobacco control. And then one other thing I'd like to add that I hope is going to be useful for other people here who are in NGOs. I believe there's rarely ever any small to medium-sized NGO that doesn't look for funding. And we've been in that situation, of course. What we realized over the years is that most funding opportunities encourage or require you to seek synergies. And these synergies don't suddenly come up, when a funding opportunity comes up. These synergies should be in place before funding opportunities come up, and you need to showcase that you're able to collaborate. And we found that we've lost a lot of opportunities because these synergies weren't up and running or in place when funding opportunities emerged. So that's an additional sort of practical aspect about why we feel like synergies are very important in our line of work.
Thanks so much, Noor. I actually had that point on funding as kind of my wrap up without knowing if anyone was going to talk about it, just to add it in because it's so important. And I think now actually more than ever, it's important because with the pandemic, we've seen how all of our capacities are stretched, I think, to the max in terms of human resources and financial resources. And one of the kind of things that I'm really working on now within my own organization is how to maximize the capacity that we have through synergies and collaboration. Because, you know, we can't do it all. We're a very small team. And I think that's kind of the same for everybody. So it's like, okay, well, where do we have expertise? Where do they have expertise? Where do they have funding? Where do they have on the ground contacts? And thinking about, like you said, building those partnerships to allow to also maybe kind of ease some of our capacity restrictions, but also in terms, it's more interesting to funders as well, like you said, right? It's not a one-man show. So I think that's really important. And I want to come back as well to the funding. I've already now got a list of things I want to come back to, but I think that's really important piece, and it will be kind of a major obstacle, I think, and I think we're touching on the obstacles later on. So I want to come back to that, but I want to just pass it back to the UICC colleagues for just a second to do a little quick poll, I think, with the audience. So I'll turn it to Alessandro or Yannick.
That's me. Thanks, Leslie. Absolutely. So I think it's quite nice to bring your perspective quite early on into the discussion. So we've devised a couple of polls, and this is the first one. So I will quickly share my screen. So the way this, the way it will work is I will send you, we have a question for you, and you probably can see the screen and see the question. The way you can answer this, preferably if you have a smartphone with you, but you can also do it on a different tab on your computer. If you go to the website, you can see here at the top, www.menti.com. And as I said, you could do it with your smartphone, probably it's easier, or you can also do it with your computer or laptop that you're connecting from. And once you go to that site, you can enter this code here, which is 4376602. And you should be able to see either on your phone or on the tab of your computer these questions. So what we're asking you is, what are the main obstacles, and Leslie referred to those, to implement tobacco control measures in your country? So we're asking you to rank these 6 areas of challenge that my colleagues at UICC have identified as possibly typical obstacles that you might encounter. So you might, there's no community coordination, low prices, lobby from the tobacco industry, lack of political will, poor prevention programs of gaps in tobacco laws. So you will be able to rank them from the first, so the main obstacle, to the 6th, which is possibly the one that appears less in your particular country. And you will be able to see, as people vote, the results coming up in my shared screen. So maybe I'll give just a bit more time to the participants to get a grip with this new polling system. We have 12, 13 responses so far, so it'd be nice to get quite a good numbers. I know we have about 50 participants on this dialogue, which is great. We will be using a similar system for the next question. So we have 19 of us who have voted with currently the lack of political will as the main obstacles for our participants at the moment. Leslie, maybe we got about 23 responses, so maybe while others come in, I'll let people to vote, but maybe some initial comments from you on the results as they're coming through.
Yeah, thanks. Maybe I'll just say 1 or 2 words, but I'd love to hear from the others as well. I'm probably not surprised that the top 2 responses are industry interference and lack of political will. Because a lot of people, you say you have a lot of the finances in place, you have the policies in place, but really strong political will is one of the big factors, right? And I think that a lot of the countries where we're seeing really strong tobacco control policies and laws is where there's the political will to push them through, whether it's through taxation, whether it's through, smoke-free spaces, all of that different stuff. It's the political will is really important. And I'm sure Adriana and others, but maybe even Adriana especially, the tobacco industry interference is a big one, and it'll always be one. And I think that's what makes the tobacco and also, alcohol and other unhealthy commodities, that's what makes it so particular, right? The difficulty to work with the private sector, the industry interference. We don't see the industry interference in other areas, right? Not quite as prominently. So I'm really not surprised that those two are up at the top. And then probably the no community coordination is also really important, because we're not going to make progress as everyone's kind of just working in their own little silos off to the side, doing their own thing and not working together. So I'm really not surprised to see that. But I'd like to just maybe hear from everyone if they wanted to take a minute kind of just to reflect on what we've heard from the participants in terms of what they think is the main obstacle. Adriana, do you want to start?
Yes, perfect. Thank you. Yes, as you said, Leslie, this is not really surprising that these are the two first elements that the people see, and it's good that we are having all more or less the same approach in this. And I think that, and I see in the chat a comment from Laurent, that he's saying that more than the lack of political will is a lack of awareness, and I think that this is part also of the thing. We should think, and I as a head of the convention secretariat should believe that all our parties know very well what they need to do under the FCTC. But the problem is that in the 16 years that the FCTC has been into force, many people has passed in the main seats, let's say, at governmental level. So really, we need to keep on doing from our side to the government and from the side of the civil society to the rest of the population, work on awareness of the FCTC, on the measures that we can have, and on the nature of the tobacco industry, that unfortunately has not only been evil by itself, but now is like contagion, making a contagion of the other industry, because we see other industry playing exactly the same playbook that the tobacco industry have played in these years. That's my impression.
Thanks very much. And yeah, Laurent, very good point in there about the awareness raising as well. And I think that's where we come in as advocates and also people working in tobacco control is bringing the FCTC, raising awareness around the FCTC, also helping kind of elevate the profile of it. And that's what I think a lot of us are doing at the moment, with kind of linking it to the sustainable development, linking it to COVID recovery, trying really hard to just raise awareness of this treaty that already exists. And Adriana can speak later about the global strategy, about this set of key priorities that are proven measures for tobacco control. And so I think we still have a lot to do as a cancer community and as a tobacco control community around that kind of awareness raising. So thanks for that point, Laurent, and also for your comments there, Adriana. Anil, do you want to jump in on anything here before we move on to the next question in terms of the results?
I again agree with everything that has been said, Adriana, and your little summary of what she said. I'm not surprised to see lack of political will, but many of us advocates, if I can take the liberty to say, pass the buck and say there's lack of political will. I'm going to quote to you a statistic to show that policy makers do put things in place. We have plain packaging now. We have ban on advertising. So look at 2007, and this is from the WHO website. 1 billion population, 15% of the world population at that time had one comprehensive tobacco control measure in place. Look at it now, 5 billion of the world population, 5 billion, 65% of the world population now have one comprehensive tobacco control measure in place. So there has been some political will to influence more people, but I agree it may not be adequate. Yet, despite 65% of world population having one comprehensive tobacco control measure, you see the figures going up and up and up. And as I said in my opening comment, in low and middle income countries. Again, if you ask me, why do people take tobacco? It's ease of access. In my country, about 20% of people chew tobacco. The efforts are towards smoked tobacco. No one really bothers about the low price products that come in our part of the world, whether it's chewed or the cruder forms of cigarettes that they smoke. So it's access. And access is because of availability and prices. So to me, the single thing that we should drive is to take away access to tobacco products among public. And for that, it's taxes. And I think there's enough data, literature is replete with the data to show you raise taxes, it takes tobacco away from the common man and consumption decreases. Look at France and South Africa. They did in 1 decade what the US took 3 decades to do, and it's just taxes. So I would say political will is weak. There are measures in place. We need to step up on that, but we have to take away access of the use of tobacco. So it has to be multifactorial, various efforts to decrease tobacco consumption. Back to you, Leslie.
Great, thanks so much, Anil. The raised taxes, I want to come back to that on the how, because I think that is also a very, very relevant argument, especially in the kind of post-COVID recovery discussion. So I want to come back to that one and spend a little bit more time on that. But Noor, why don't I just turn it to you for this one? And I might actually skip the next question, but let's just hear from you first on some of these, your thoughts on these results.
You know, I think we're all on the same page. I think we differ in how we look at it and what our starting point is. From my perspective in Jordan, I think lobbying from the tobacco industry, be it direct or indirect, is the key root of all of this, because what we've seen in Jordan is that the tobacco industry is a key source of profit for a very under-resourced government. And the fact that they rely on these profits, the government relies on these profits, is what drives, or actually what drains the political will. And so everything can be tied back to this drainage of political will, because they feel like they need the profits from the tobacco industry, is what causes everything else that we see in terms of, you know, no desire to really be proactive about tobacco control, little desire to improve policies, absolutely no desire to make accessibility harder, no desire to increase prices because they're worried that that will drop demand. And then there are issues about, well, you know, our water pipe cafes. Water pipe is a big thing in Jordan and in Middle Eastern countries. And there's that concern of, well, if we're trying to lower the presence of these cafes, we're impacting tourism, we're impacting small businesses. So it all goes back to profits. And that's what really drives the poor political will, and therefore everything else falls after that. The fact that we have poor community coordination because there's no leadership in place to say, look, we really need to do this. The fact that we have poor prevention programs because no one's looking to the long run. Prevention very much needs a long-term vision. It needs for us to recognize that our returns on investment come after decades of investing. And, you know, on the other hand, you've got dollars coming in on a daily basis from the tobacco industry and from tobacco users. And so for governments that are under-resourced, unfortunately, prevention just doesn't, it's just not appealing. And so I think what I'm doing is basically agreeing with everyone, but just showing you how, from my perspective, I feel like it all boils down to the profits that the tobacco industry claims are indispensable.
Thanks so much, Noor. And I really liked how you kind of just demonstrated how they're all interlinked, right? Because I think it's what's difficult is, you know, if you think about it, kind of all trickling down and them all being interlinked, is you need to start somewhere up top, right? And we're talking about the industry and the lobbying of the government and how the government, you know, gets the profits from that, and then all of the rest trickles down, because none of these decisions or none of these actions are taking place because of the government, because of the industry. So I really liked how you kind of summarized how they all work together. And what I'd like to do actually now is, in my capacity as moderator, Yannick, I'm going to skip question 2. What I'd like to do is go right to question 3, which is the kind of what needs to happen, what can be done, and then go back for one more question with a poll, so that we can kind of wrap up there and hear some thoughts from the moderators. Sorry, I'm the moderator, from the speakers. So I've heard a lot already about, you know, the different tools that are out there, the opportunities for collaboration, the lack of funding, the industry interference, the lack of political will, the need to raise taxes. The list is long of the things I've jotted down. But I want to maybe turn to each speaker again and ask, you know, what do you think needs to happen to support the policy development and implementation of these kind of key measures? What do we need to do, whether it be the tobacco control community, the cancer community, just us as advocates and people that really care about this issue? If you could say the kind of top 3 things you think we need to do, or any types of, you know, top tools that we already have that exist that we need to push more to help address the tobacco epidemic. Now I'll start actually with Noor. I know you just spoke, but I'm going to go back to you to start first this time.
Okay, I think if I were to suggest the key things, that what would it take? First of all, let me start by saying, I know that, you know, in my previous answer, I may have sounded really grim, but I do believe in the power of NGOs, even with the lack of political will. And I think one of the first things that any community or any country can do is just get a restock of who are the NGOs in the country. I mean, really know who your stakeholders are and who the NGOs are. Surprisingly, there are hundreds of NGOs, if not thousands. And some of them are very active, some of them are barely active. We really need to know who's who, and how we can interact with them, how we can reframe the tobacco control issue so that it becomes appealing to them. And so one of the first things that I would recommend, and I think we need to do this as well, is really have a thorough quantitative analysis of who are the NGOs that exist. And they don't necessarily have to be health NGOs, they can be other NGOs of interest, and how, whether or not there's potential for those NGOs to contribute to the tobacco control board or tobacco control efforts. The other thing that I would do is really try and identify a leadership or a leader entity that can offer to take on how these NGOs can coordinate their efforts. And I say this because in the past we've tried doing this, and because no single entity stepped up to say, look, I'll coordinate efforts, I'll make sure everyone's on board, I'll make sure we sustain these activities, because there was no single entity that offered that, our efforts sort of just dissipated. And this is key, because yes, we want synergies, and yes, we want NGOs to come together, but NGOs won't naturally come together unless there's one power that's trying to sustain those synergies, or maybe one or more, but it needs to be proactive. It's not going to happen naturally, and it's not going to sustain itself naturally. It needs someone or an entity or maybe a few entities coming together to be proactive about maintaining these synergies.
Great, thanks so much, Nora. And I think you mentioned as well the kind of need for other NGOs. It doesn't just have to be tobacco control, and we've seen that popping up in the discussion as well. And I think that's absolutely critical. I think that in the past, a lot of the kind of tobacco control folks have kind of stayed in their silo working in tobacco control, and we've seen now it's A, that doesn't work, and B, the importance around working with other health-based NGOs and other just, the health community in general, the NCD community, the development community, and now with, the illicit trade folks, there's other kind of communities there we need to work with. And I think what we've done is for far too long is kind of work in our own little area. And now I just keep saying now more than ever, but I think it's really important now more than ever to work with a really, really broad community, because we all have the same messages. And I want to come back to your point really quickly on the coordination, because I agree coordination is absolutely key. And I feel like everybody says we want, you know, we need coordination, but a lot of times nobody actually wants to be coordinated. Right? Nobody wants to be told what to do or what they should be working on. And everybody kind of wants to say that we're collaborating together, but doesn't really actually want to do it. And so maybe we'll come back to how we can actually do that. But I want to turn to Anil and just to hear kind of what you think those tools are, those ways that we can achieve some of the stuff that we talked about today, whether, you know, you want to come back to the taxes you already mentioned, but any other types of kind of tools or things that you think is absolutely necessary that we need to do as a community to address the tobacco epidemic.
So Leslie, you said that we should share 2 or 3 of the top priorities or tools, and a lot of what I wanted to say is what Noor has already said. So I'm going to rephrase my answer in a different way. I believe the 3 things we should do is target 3 different groups. First, the public. Raise awareness about tobacco, tell them about the harmful effects, target the youth. We know that if they don't start by 19, 20, 90% would never take to tobacco. So the first thing is target public, raise awareness. The second is identify stakeholders, exactly what Noor said, and empower them with strong messages. They should understand the clear determinants of tobacco consumption. Taxes are important, the pricing policy, so that they have clear targets to work on rather than just beat around saying tobacco is bad, all pulling in different directions with one message, but clear targets so they can go and hit at that. And the third thing is target government and implement a lot of the FCTC measures. If that's in place across various governments, I'm sure the tobacco consumption will come down. So my 3 things is break down to 3 areas: public, the key stakeholders, and government and policy makers, with the few examples that I've told you and what Noor has said. And I'm sure Rihanna will share something in same lines.
Great, thanks very much. So again, kind of the stakeholders and the raising awareness is coming out as really key priorities as well. Adriana, I'd like to hear from you, and then we'll go back to the group for another quick question so that we have something else to comment on.
Thank you, Leslie. I think that from my part, and of course I will declare my conflict of interest, I will say that one of the tools that is available for everyone is the FCTC. Because the FCTC itself first in Article 4.7 recognizes the important role that civil society plays in tobacco control. So that is opening the door for the civil society to be incorporated at national level in work, and the new strategy that the parties have adopted in 2018 in the COP8 has one of the 3 pillars that is partnerships and collaboration, and is with the IGO, the International Intergovernmental Body, and with NGOs. So I think that tools give the support, let's say, that the legal support that the civil society can have. And the civil society has one thing that is very, very important, that I think is and that will be my second point, is civil society can make the politicians aware that if they don't follow the interest of the groups, that can have a cost, and a political cost. So at some point, as Noor has said, I think that yes, it's true that the countries depend a lot on the tobacco industry, but it's really kind of lieful. I don't know how to say in English, mentiroso. It's a way of portraying the thing in a wrong way, because when you really show to the government that first the money that they get from the tobacco industry, usually the big source is the pocket of the people, because it's the people who pay for the product who pay for that, and the people will still keep on buying things the day that tobacco is not anymore available or around the world. The people is not going to put that money on the bank. So the second thing is the balance never fits, because when you see how much the tobacco industry provide, but you see how much it costs in diseases, yes, it's true that in order to save that money for the diseases will take a lot, but the health system will not be able to cope in any country, developing or in transition, if we don't decrease the number of people that is sick, and the tobacco is one of the main things. So I think that the raising awareness is important for as a way to really demonstrate to government that also not doing things has a political cost. Not only for doing, not doing also is something that they can be responsible of.
Great. Sorry, I was just writing down the rest of the thoughts there. Yeah, really good. And I think, as you mentioned too about your tool as being biased, but that's totally normal in given your position, that you have this FCTC tool. And I think even more precisely, as I said before, the global strategy as well. And I think that there's a lot of awareness raising that we need to do as a community too about this strategy. Saying that this works. These are the proven kind of measures. These are the top priorities for community, because a lot of people will look at the FCTC and say, oh gosh, where do we start? Or this is this big treaty, and say, oh look, actually we've got this smaller package for you to use. And maybe what we can do too as a community is do a lot more awareness raising around this strategy that exists and how to actually use it at the national level, right? So I want to actually just turn to one more Mentimeter, I think the word is, question, because then I want to take the last 10 minutes or so to be able to hear from the audience. So I think Alessandro will put it back up on the screen.
Thank you.
Go ahead.
Thank you, Leslie. So we have another question here that I'm going to quickly explain on sharing my screen. It will work similarly as before. So we're trying to ask you, maybe as you see it on your mobile or on your screen, might be not that intuitive. So we're asking you to rate the following potential collaborative actions, both in terms of potential impact and in terms of the effort required to bring together the key players and to achieve that impact. So think on your phone, if you go again to menti.com and enter the code 4376602, you are able to rate each of those 5 potential collaborative actions from 1 to 5, both under impact, and from 1 to 5 under effort, where 5 is as a high impact and 1 is a low impact. And for effort, high is it requires a lot of efforts to achieve the impact, and 1 it's a minimal effort. So we really try to compare both, not only the potential for these actions to achieve the necessary impact in tobacco control, but also what is the effort required, because as Leslie mentioned, sometimes it's not just we're not collaborating effectively because we don't want to, but because it requires skills, it requires sorts of getting together, and it requires a certain effort. So again, as the answers slowly came in, we're going to give a little time. I think we had 32 votes in the previous poll, so hopefully we get similar numbers on this. So maybe I'll just read through the 5 collaborative actions that we're asking you to rate for impact and effort are: raising public awareness, share mutual experiences, knowledge, and best practice, build capacity in the communities for policy change, focus on countering the tobacco industry misinformation and lobbying, and the 5th one is advocate for an increase in sin taxes, so an increase in taxes on tobacco, for example. Obviously, this grid, Leslie, in a second, I'll let you comment as the results come in. We have 23. So obviously, it will be interesting to see possible actions with high impact and high effort. At the moment, there's quite a lot in the top right quadrant. That seems requires a lot of effort, but the sorts of the price what we're going to gain out of that effort is also quite a lot of impact. So there seems to be converging in that quadrant. So I'll leave you maybe to give some thoughts on what you're seeing coming up from the poll, huh?
Okay, yeah, so maybe we'll just we'll stop there. We can start talking about this now. I was going to say I might have to analyze the results, but it looks like everything is going to take a lot of work, but will pay off in the end. Is how I see that here. If I'm reading the graph correctly, it's all very important. We will see the impact that all of this work has, but it's going to require a lot of work. And except for maybe number two, and I would tend to agree with that. I think it's easy enough for us as a community to just share our mutual experience and knowledge, right? So it's as easy as just having something up on the website, sharing something via listserv, having a chat with someone and telling them what you've learned or sharing your experiences. So I'm happy to see that we all think that that's not as much work as some of the other stuff. And even raising public awareness is, I think as a community, every time we speak about something, we're invited on a panel or we're attending a meeting, and once we are in person again, seeing each other, get those messages out there, whether it's public awareness to the public or to your other colleagues, is just start putting those messages out there. So if we're saying, we need to increase funding for tobacco control, which I think is really important and a big obstacle that we touched on, we need to be saying that all the time, that low and middle income countries need more funding, they need more support. NGOs need to collaborate together. So I think that the public awareness raising is important, but I think it's also just raising awareness within our communities and within other communities that we have a very good kind of relationship with. It's just being annoying about those messages if they're really important and just saying them over and over and over again. I don't want to go on to all of them because I think that we know that capacity building is really important. Countering the tobacco industry is really important, and the advocating for increased taxes. They're all very important, and we would see massive amounts of change if we were able to successfully kind of do all of those things. But the message to take away is it requires a lot of work. And I think that we know that. So I just want to take one more minute and just maybe if Adriana, Noor, and Anil, if there's anything that stands out in these results that you'd want to speak to, and then I want to take a little bit of time to get the audience to weigh in here. So Adriana, anything from you that you'd like to just reflect on seeing these results or anything?
Yes, that I can understand that, yes, really, there is a lot of effort involved, but sometimes we need to see what is doable, because between the perfection and the good, we know that there is also always a space. And what you said is very important, just to put in all your messages a little something regarding the other side. Let's say when we talk about tobacco control, to remind the people the importance that has as a preventable cause of cancer. For example, that cancer is so bad that I see when you have a preventable cause, is almost ominous that the people is not really 100% aware that this can prevent cancer. So perhaps it's not that you need to go in full capacity to each one of these areas. You need to choose one, perhaps, and you need to try to do what is in your hands, because a small step if it's in the right direction is important anyway.
Thanks. That's important to say too. We don't have to be perfectionists, right? Every little step counts, and I think that's important for us to hear. I tell myself that all the time. Sometimes good is good enough, and sometimes those little baby steps will already see change, right? So Noor, any quick thoughts from you on this?
I want to reiterate, Leslie, what you said when you saw the results, and you focused on the very first one, which is share mutual experiences. I'm one of the people who thought that this would have potential for full impact and less effort. And it really is crucial, because as you're sharing mutual experiences, you can build synergies. And you can share ideas about how to do everything else that's listed here in terms of raising public awareness and in terms of even building capacity. So sharing those mutual experiences, creating, even if it's international, not local, creating synergies or information synergies, let's say, that has so much potential to really change the way local NGOs are operating in the field. So I very much am excited about the prospect of what sharing mutual experiences and knowledge can do in the tobacco control field.
Great, thanks, Noor. And Neil, any last comments on this before we open up for a quick 10 minutes?
So Leslie, in the interest of time, I agree with what Noor and Adriana have said. I would also probably grade exactly the same as our viewers have polled with the same rating. But I'm going to digress. And tobacco has been a problem, and we are in the run-up to the World Tobacco Day on the 31st of May, and this time it's commit to quit, and that's the theme this year. And I just want to tell you, in the time of COVID, that COVID has hogged so much of time, space, money, efforts. If we can drive the message that if you are a tobacco user, the risks with COVID and the mortality is much higher. Maybe we'll get people to quit. It's the right time. We know that turning cold turkey is one of the best approaches to get people to quit. So I'm just taking the opportunity to raise this point, raise the awareness among everybody who's attending today and work in the tobacco space, that just don't lose this opportunity. Maybe it's an opportune time to get more people to quit. And really, among all measures of EMPA, the quit is what has had the least effort amongst all of us who work in the tobacco space. It's a little, I'm digressing from the question you asked me, but I agree with the other two on what they've said.
Thanks so much, Anil, and I'm glad you put that in there, because that is a very important point that you just mentioned there. I just saw in the chat box too, I'm trying to monitor it as I'm also trying to listen in here, that someone had just mentioned, I believe it was Anka, about the capacity gap within the tobacco control community to effectively advocate for an increase in taxes, and that there are some resources and materials out there. She mentioned the kind of resources within the Knowledge Hub, and that this is going in the right direction. But I think that's the general kind of capacity gap to cover a lot of these things is really, really important as well. And thinking about how to build capacity, not just of people within the countries and tobacco control, focal points or people working with government, but building capacity of civil society to be able to talk with confidence about these issues. And so that's something I think that we need to also think about, is becoming effective advocates and kind of experts in some of these areas to confidently send out those messages. So I think that's a really important point, Anka. Any other questions that are coming up? I've seen a couple in the beginning. If Yannick, I'm not sure if we should pull some up from the beginning, or if anyone else has any burning questions that they wanted to put in the chat right now. I know it's been.
I think that we had a question from Caroline about the smoking cessation after cancer diagnosis.
Right, I'm just going to pop up to that first question then. Yes, we had a question asking if the speakers could address the importance of tobacco cessation after the cancer diagnosis, as it so impacts the response to therapy, outcomes, survival, and risk of second cancers. Maybe I can turn to Anil to start with that. I just kind of threw you on the spot there. But any thoughts on that question about addressing cessation after the diagnosis?
Yeah, so I think it's a very important point, and I'm going to answer this not from theory, not from what I've read from things, but just as a pure clinician. So the moment people do get a diagnosis of cancer, a lot of them turn cold turkey and kind of stop or decrease their habit. But this point is very, very relevant. As time goes on, they're into their treatment or they get cured, people do relapse, and that's a very, very strong cause for breaks in treatment, for recurrence of cancers, and for getting what's known as a second primary cancer, or a third primary cancer, or a fourth primary cancer. So I think our efforts have to be very, very strong. The moment a patient comes with diagnosis, yes, the harmful effects are highlighted, but it has to be sustained. But that means right through the course of treatment and subsequently. But more importantly, and again, a pure clinician view on this, that's the time to hit family relatives and their near and dear ones to stop the habit. So while you do enforce this with the patient, you must capitalize on that opportune moment and influence others who are in the space of the patient to stop the habit. Those are my clinical comments on this issue.
Great, thanks, Daniel. Any thoughts from Adriana or Noor on that, or do we want to just move on to the next question?
Leslie, I can add to that, because I think what Dr. Anil said is crucial. And building on that, what we've done in the hospital is we've tied tobacco use documentation into our accreditation system. So I believe almost any hospital or every hospital in the world has an accreditation system. And there are accrediting bodies, be they local or international, that follow up on, you know, many different indicators in hospitals. And what we've done is we've tied documentation of tobacco use and referring cancer patients who smoke to our cessation clinic as indicators of our performance as a hospital. And that has facilitated us seeing all cancer patients who smoke, because unfortunately, if you leave it to them to come into the cessation clinic, then referrals are not going to be that great, and we will not see all cancer patients who smoke. So there needs to be a system level change, in addition to clinicians being proactive with our patients, like Dr. Anil said.
Great, thank you so much. I'm looking at the time, and I always try to finish on time as that's I think my main job here is to keep the discussion on track. So what I want to do is make my job as a moderator a bit easier, and maybe ask the three speakers if there was one message, because I know that we've just heard a lot of stuff over the past hour, and I'm sure everybody was taking notes. I'm sure of it. But if you're thinking about what are those three things, so if we asked each person, each speaker, one message that they would like everybody on this call to walk away with today, that's kind of going to stay in their mind, what would that be? I'll start with you, Adriana.
I think that I would say very briefly that together we are stronger.
Together we are stronger. Very good, very good. Noor, any last one-line thoughts from you? What's your main takeaway?
I'll do a long line. No, I'm joking. So I think my take-home message for me and for everyone else would be that NGOs, regardless of their size, have so much potential power to change things, and just know who those NGOs are. Just be aware of your partners or your potential partners, even if you still don't know who they are.
Great, thank you. So kind of collaboration, stronger together. NGOs have a ton of potential, and I think we need to strengthen that collaboration, identify who those partners can be. Anil, any one-line thought from you for a takeaway message here?
Disadvantage speaking last after they've said what I wanted to say, but I'll reiterate. A coordinated approach that includes knowledge sharing, capacity building, strong advocacy messaging will support the implementation of efficient anti-tobacco measures and counter the industry.
Thank you. That's really great. That almost looked like my one last liner that I wanted to take away. So now that I have to finish, I have that same problem as you. I just said that, and I think those are all really important, and it summarizes everything really well. Collaboration, coordination, need for advocacy, awareness raising, capacity building. But I think all of that's even more important now for tobacco control in the kind of post-recovery discussions. And the kind of need to raise awareness and increase taxes and collaborate, because without these kind of different messages and advocacy opportunities, I just feel like there's this issue that tobacco control is going to continue to kind of fall off the radar, as we've seen a little bit with COVID. And rightly so, the COVID pandemic deserves all of the attention. But coming out of the pandemic, thinking about ways to kind of find these synergies, collaborate during these times is going to be more important than ever. And this kind of dialogue was a really good opportunity to start that, because I think we as a community have a lot of work to do when we come out of the pandemic to ensure that tobacco control is kind of positioned as a very, very key important issue that we all need to be talking about. So I think yeah, we have a lot of work to do, as we saw on that little table as well. And I think the kind of coordination and advocacy and capacity building is going to be key. So I'll turn it back to Yannick. We've got no minutes left, but maybe if you just want to say 1 or 2 words before we wrap up this first dialogue.
Thank you, Leslie. Thanks to all the speakers and the participants to that first virtual dialogue on tobacco control and cancer. We will have another one early July, and please stay tuned and go on the uicc.org website to have the news about tobacco control and cancer. And thanks a lot again for everything you've done today. Thank you. Thanks a lot. See you soon.
And a big
Bye.
thank you, Yannick, to you and your UICC colleagues for organizing this. It was a great first virtual dialogue on tobacco and cancer. So big thank you, Yannick and colleagues.
Thanks, Alessandra.
Thank you for having us.
Thank you for all the